Welcome to the Explainer. Today, we're diving into the battle against a particularly nasty superbug. Imagine a form of tuberculosis that's learned to outsmart our go-to medicines. That's multi-drug resistant TB, or MDR-TB, and it's a huge and persistent challenge for public health.
All right, so here's our roadmap for this explainer. We're going to start with the threat itself. Then we'll get into how we actually find this thing, the diagnosis. After that, we'll look at the arsenal of treatments we have. And finally, we'll zero in on the crucial role of nursing and the care plans they use.
Okay, so first things first. What exactly is this superbug we're up against?
Okay, so here's the deal. This isn't your standard TB. We're talking about a version that has literally evolved to resist our best drugs. Think of it like this. The two most powerful antibiotics we have, Isoniazid and Rifampicin, they're like the master keys. But for MDR-TB, the bacteria has changed the locks. Those keys just don't work anymore.
And wow, this really shows you just how tough the fight is. When our best shots fail, things get serious. Globally, the success rate for treating MDR-TB is only about 63%. That means back in 2020, more than a third of patients weren't successfully cured. That's a really tough number.
And the symptoms? They're what you might expect from TB, but often way more intense and just relentless. You've got the persistent cough, the chest pain, fever, night sweats, weight loss, all of it. But with MDR-TB, it just drags on, which is a pretty clear sign of this serious battle happening inside the body. So, what's happening on a microscopic level? Well, it's basically evolution on hyperspeed. The TB bacteria are smart. They mutate their own genes. This messes with our body's first line of defense, the special immune cells in our lungs. So the bacteria survive, get stronger, and essentially rewrite their own software to ignore the drugs we're throwing at them.
Right, so if the usual treatments are off the table, then everything hinges on one thing, finding out exactly what we're fighting. How do you spot this specific superbug? Well, speed is absolutely everything.
And this is where things get really amazing. You've got the old way, these culture-based tests, that would literally take 4 to 6 weeks to get an answer. Weeks. Now we have molecular tests that go straight for the genetic code, looking for those resistance mutations. And the turnaround time? As little as 2 hours. That's a total game changer.
And you can see why experts are so excited about it. This quote really says it all. A test like the XDR-TB MTB/RIF is seen as a huge achievement because it gives doctors that critical rapid diagnosis they need.
And check out this number, 98.6%. That's the sensitivity. What that means in the real world is that doctors can be incredibly confident in the result. It's almost as good as the old gold standard methods, but instead of waiting weeks, they can start the correct treatment on day 1. No more wasted time. Okay, so we found the enemy, and we found it fast. Now for the really hard part. How do you actually treat this thing? So this is basically the modern playbook from the WHO, and you can see a really important trend here. We're moving towards shorter, all-oral treatments. For instance, the BPAL-LM regimen is just 6 months. Now, you have to understand, this is a huge deal for patients. We're talking about replacing treatments that could last for 18 months or more and often involved painful daily injections. It's a massive leap forward in care. But putting together one of these treatment plans isn't like just writing a simple prescription. It's more like being a general planning a complex assault. You have to carefully pick drugs from different groups, layering them together to create this powerful cocktail. The goal is to attack the bacteria from multiple angles at the same time, making sure you always have at least 4 effective drugs in the mix. Having the right drugs is absolutely crucial, but it's really only half the battle. The success of this long, grueling treatment, so much of it comes down to the people on the front lines, day in and day out, the nurses. And the care they provide isn't just guesswork. It's a systematic, evidence-based approach. Nurses use established guides, like the Handbook of Nursing Diagnoses, to create a structured plan that addresses all the complex needs of these patients. So what are their priorities? Well, obviously, it's things like making sure the patient can breathe and preventing the infection from spreading. But it goes so much deeper than that. It's about supporting them, helping them find ways to cope, and making sure they have all the information they need about what's happening and the long road ahead. All right, let's drill down a bit and look at the actual blueprint nurses follow. This all revolves around what are called nursing diagnoses.
Okay, first up, one of the most immediate problems, ineffective airway clearance. Basically, the patient can't breathe properly. The disease creates all this thick mucus, and the person is just exhausted. So a huge part of nursing care is focused on simply helping them clear their lungs so they can get enough oxygen. Next up, imbalanced nutrition. And this makes perfect sense, right? The disease itself, plus the really strong drugs, just drain the body. Patients often have fevers, they're tired, and they have zero appetite. So a nurse has to get creative to make sure that patient is getting enough nutrients to actually have the strength to recover. This next one is a huge one, ineffective self-health management. I mean, think about it. You're asking someone to take a whole bunch of different pills every single day for months and months, and many of these pills have nasty side effects. Just helping a patient stick with that plan is an incredibly important and difficult part of the job. And then there's deficient knowledge. It's really hard to stick to a tough plan if you don't understand why you're doing it. So a huge piece of the puzzle is education, making sure the patient understands their illness, knows how to prevent spreading it, and really gets why taking every single pill is so important. And number 5 is activity intolerance. The fatigue and breathing issues are so bad that just walking to the bathroom can feel like running a marathon. So nurses work with patients to manage their energy, finding that perfect balance between getting enough rest and doing small activities to gradually build back their strength. Beyond the problems that are happening right now, nurses are also always looking ahead at potential risks. A big one is the risk of the infection spreading, especially if the patient's immune system is weak. And another is the risk of dehydration. With all the fevers and night sweats, it's really easy for a patient to get dangerously dehydrated. So when you look at the whole picture, from the super fast diagnostics to the newer, kinder treatments, and especially the comprehensive nursing care, you see that every single piece is vital. But it all comes back to this one big question. Treating MDR-TB really is a marathon, not a sprint. And the challenge for everyone in healthcare is figuring out how we can innovate and support every single patient, not just to start that race, but to make it all the way to the finish line.